I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration. Today, we're going to talk about the continuing battle with opioid addiction and what is being done to provide healthier choices for dealing with pain. Chris Fox, the Executive Director of Voices for Non-Opioid Choices, joins us to shed some light on the efforts to provide healthier choices for pain management. Chris, welcome to the show. Tell us a little bit about yourself and what you do.
Thanks, Peter. Thank you for having us. So as Peter mentioned, my name is Chris Fox. I'm the executive director of a coalition that is based in Washington, D.C. called Voices for Non-Opioid Choices. And as executive director of Voices, what we do is we work to advocate for federal policy change to increase patient and provider access to and utilization of non-opioid approaches and strategies to help patients manage a short episodic acute pain incident. And so that means for us that there are very real barriers that get in the way that inhibit patient and provider utilization of non-opioid strategies to manage their pain. And where there are federal policy barriers that inhibit this access, Voices for Non-Opioid Choices exist to tear down those barriers. And we advance meaningful federal policy approaches that will simply increase and incentivize the utilization of non-opioid treatment options for patients and providers.
So let's, for sake of knowledge, take us back to sort of the beginning of this crisis, where we had a rather robust medical and pharmaceutical effort to deal with pain. And as most people by now know, some people took advantage of doctors, spread some mistruths, and sort of initiated this opioid process that grew out of control and essentially led to tens of thousands of fatalities from addiction. Is this sort of a reset back in time to say, wait a minute, let's pick up where we left off and now recognize that this wasn't really the best solution for everybody? Or has the world changed so much that we're starting from scratch?
Well, I don't think it will surprise anybody to know that there are a lot of opioids that are prescribed every year in the United States. Some estimates suggest that there are around 10 billion with a B opioid pills that are prescribed every year in the United States, which is enough opioids for everyone, every man, woman, and child, to have their own personal prescription of 33 opioid pills apiece. I'll stop just to let that sink in for a little bit, because that's a lot of opioids. Now, what I want to say is that opioid prescription has a valid clinical use for certain patients, but not all patients. And so what I want to say is that at Voices, what we believe is not that necessarily opioids are bad. I think that we want to make sure that we are being responsible stewards of these powerful pills. But what we also want to say is let's explore other pain management strategies that may come with fewer risks, fewer things like opioid adverse events or the risk of opioid misuse, addiction, dependence, and ultimately sometimes overdose deaths. Peter, I think you're exactly right. There have been tens of thousands of opioid-related overdose deaths that have happened in the last couple of years. And I think that, when we look at this problem, for years it was getting a little bit better. I think that what we saw at the end of 2019, we're seeing now data come out that say that there were 70,000 deaths related to opioid overdose, which is an enormous number and one that sort of flies in the face of recent progress that we've made on this epidemic. I think what we're seeing now in the context of the COVID pandemic is we're starting to see the problem get even worse. That we're seeing people who are relegated to their homes where they can be have relatively easy access to unused pills that might sit in medicine cabinets. We see added stress due to potentially losing their job or health insurance or other things. And unfortunately, in some certain individuals turn to substance abuse to cope with the stress. And I think we're starting to see this bear out. I think the White House has recently said that opioid overdose deaths are 11% higher through the first half of 2020 as compared to the first half of 2019. So we're starting to see this problem become even worse than it was even last year when opioid-related overdose deaths were higher than they had been in previous years.
Yeah, and that's why we have you on the show, because we see this rise and it's scary. And interestingly enough, how many countries in the world suffer from this kind of problem at this magnitude?
I think it's one of those things where we don't like to see America lead the way. But unfortunately, we see this opioid addiction epidemic with America leading the way. And by some estimates, you can see that the vast majority of opioids prescribed in the world actually take place in the United States. And this is an unfortunate incident, but I think what, again, we say is that we're not necessarily anti-opioids, but also we know that there are, for those those approximately 10 billion opioid pills that are prescribed. We also know that this is from about 170 opioid prescriptions that are dispensed. 170 million opioid prescriptions that are dispensed every year in this country. And so what we say is we think that we can do better by simply making available non-opioid options, which we know by and large patients and caregivers prefer when given the choice. The fact is right now that choice often isn't up to the patient, it isn't up to their parent or caregiver, and frankly, it's not up to the provider that's treating them.
All right, we're gonna really touch on that after the break. That's a very, very important point. When we come back, we'll continue the conversation about opioids and alternatives for pain management and why the system isn't so easy to negotiate when you want to look at an option. See you after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Right now, millions of people and billions of devices are connected to the internet. Homes, businesses, hospitals, schools. The security and reliability of these connections are more important than ever. That's why at Mediacom, we've built a network to protect them. A network that sees threats, fixes problems before they occur, and keeps you going with 99.99% network reliability.
Back to Surviving Bad. We're talking about opioids and the effort to help people find safer alternatives for dealing with pain. Chris, you just finished telling us how the system, let's call it the system, isn't really geared to a lot of these alternatives and options. Can you give us sort of a look at why it's so difficult for doctors and the community to employ some of these safer and well-known alternatives?
Yeah, so it's a very good question, and it happens for a variety of reasons. I think first and foremost, by and large, most healthcare professionals were trained to treat pain with opioids, and this goes back decades or so when opioids were first introduced to the market, and this is what and how surgeons, doctors, nurse practitioners, and others were trained to treat people with pain. I think what we've seen in recent years is we've seen, to your point, a bit of an increased realization that there is a similar ability to help patients control and manage their pain without the use of opioids, or by introducing what we call multimodal strategies to address pain, which incorporate a variety of different pain management techniques that together can significantly decrease opioid consumption after an acute pain incident. And so when we talk about what the barriers to utilization of non-opioids when compared to opioids, we talk first and foremost about education awareness. We talk about awareness. It's, do family members, caregivers, providers, patients, do they know that options exist? Period. And all too often that answer is no. And so when we start talking about this, we start talking about how can we raise awareness and educate families and patients about their options before, during, and after surgery. Second, we have to do some work to re-educate the healthcare workforce about exactly what the ability is to manage a patient's pain without the use of opioids, or by minimizing the utilization of opioids. Third, I think we need to address some of the systemic issues that inadvertently disincentivize the utilization of non-opioids when compared to opioids, simply by virtue of the fact that opioids, by and large, are cheap. In fact, a generic opioid pill costs roughly 15 cents a pill. Whereas non-opioid options, while not expensive, certainly by healthcare comparison costs, often cost about $100, $200 or so. So when you compare 15 cents a pill to a strategy that might cost, say, $200, you're looking at some disincentive for utilizing them simply for economic reasons. And I should say short-sighted economic reasons.
So in some respects, one of the things your organization does, and correct me if I'm wrong, is to try and work to change that climate with healthcare providers and insurers to sort of trying to bring down those costs?
I think what we exist to do is to address federal policy barriers that get in the way. And the principal driver of healthcare policy is all too often Medicare policy. And so what we're trying to do is to create an awareness amongst leaders at Centers for Medicare and Medicaid Service about the ability of non-opioid strategies to help people manage their pain without the use or by mitigating the number of opioid pills that are consumed after an acute pain incident. And because there are some very real policy reasons that inadvertently incentivize the utilization of opioids, what we're trying to do is we're trying to simply say, let's take the economics out of the equation and let's just make this about patient choice and about patient care. And we think that by utilizing non-opioids, there are a number of associated benefits, including lower patient-reported pain scores, the ability to return home more quickly after an acute pain incident, fewer opioid adverse events, and obviously significantly decreased risk for opioid misuse in the future. And so because of all of this, we think that there are very good reasons and rationales for patients who want to utilize non-opioids to do so. Unfortunately, right now they don't have the choice. And so what we're trying to do is we're trying to work with the US Congress and with other policymakers at the Centers for Medicare and Medicaid Services and elsewhere to make the case that we need to advance federal policies that make these solutions more available to patients, that make them more available to providers, and that educate those providers about the ability to do so.
Now, in talking to people dealing with pain, say one of the issues here is if they go to their doctor and look for alternatives, they're not very well trained. Now, I will say that I had the honor of speaking at a grand rounds with Dr. Tom Benzoni at Des Moines University, and they are actively engaged in teaching their young doctors on the risks of opioids and alternatives to opioid prescribing. But we've lost 20 or 30 years of doctor education that has to be undone, so that takes time. So what happens when a person goes into a doctor's office and says, I heard about these multimodal pain management techniques, which almost is like speaking Greek to somebody suffering from pain. How do you recommend people address a doctor to say, I don't really want to use opioids, what are my alternatives? Do they have some rights under the law and under current legislation to explore those options, even though it's not being necessarily handed to them by the doctor?
Yeah, I think that first and foremost, what we try to do is we try to encourage patients and families to have this conversation, to develop a pain plan with their providers before, during, and after an acute pain incident. Sometimes it's not able to be avoided, but in certain cases, like an elective surgery, there is a run-up to the actual pain incident, albeit the surgery. And so what we try to do is we try to create and facilitate these conversations so that a patient can talk to their doctor, their surgeon, their nurse practitioner, their anesthesiologist, or whomever to say, look, I might have a history of substance use disorder in my family, or I might have a family member who has a addiction issue in our household, and I don't want to have these pills in a medicine cabinet for fear that they might fall into bad hands. Right now, all too often, these conversations aren't happening. And so what we say is let's try to utilize federal policy approaches to facilitate and incentivize these conversations to take place so that patients can ask these questions, that they can have thoughtful and meaningful conversations with their healthcare providers to develop a patient-specific and frankly, procedure-specific pain plan that can help them achieve the pain relief that they need and do so in whatever way that makes sense to them. Unfortunately, right now, for the reasons that we talked about, sometimes they don't have an option. And we're trying to work with Congress and others to make sure that they do have that option. But where they can, they should have these conversations with their providers before they go under the knife, when they can, to talk about what options might exist.
Those are great points, and I'd like to come back after the break. We'll take a short one and talk about a place where parents do have some options when they have some surgeries that they're supervising for their children, sports injuries and things like that, because we've seen a huge correlation between an addiction problem and using opioids when children get surgery. So when we come back after the break, let's talk about that. You don't want to miss this. See you all after the break.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we have our guest, Chris Fox, with us from Voices for Non-Opioid Choices. The opioid epidemic is still killing Americans. And in this crazy world, it's easy to forget that lots of people need help with substance use disorder and addiction. But one area where you can really make a difference as a parent or caregiver is when you have children that look at elective surgeries, whether it's a knee surgery, an ankle surgery, oral surgery. And Chris, you had some great points to raise on this that, I know from the data we've seen here in Iowa that if you take opioids for more than 3 or 4 or 5 days, somewhere in that magic period of just a few pills, the risk of addiction skyrockets astronomically. So there's a place for some of these opioid medications. But when parents are looking at dealing with children getting surgeries like that, needed or elective, well, they're generally not elective, they usually need it. How should they approach the dialogue with their doctor about looking at some of these non-opioid choices?
I think it all comes back to the point I made previously, that we need to make sure that these conversations are taking place. And if a parent is going in that has a child that may have been treated for a substance use disorder in the past, that they have the opportunity to have a conversation with their provider to say, my child may have had an issue with substance use disorder in the past, and I want to explore what options may exist to help them manage through their pain without the aid of opioids. That said, there may be other parents who want to utilize opioids that don't have any history of substance use disorder, don't have any particular aversion or bad side effects from the medication they want to, and that's fine too. I think what we say is that we think patients, caregivers, and providers deserve choices in how they want to manage that pain. And whether that is with opioids or without opioids, they should have that choice. And so to answer your question, how should a parent go about that? I think they should ask themselves and assess what relative level of risk they have a conversation with their provider, and then be honest with themselves about if they would prefer to utilize opioids or non-opioids. We know what the research shows, which is that 80% of parents, when given the choice, would prefer to have their child treated without the aid of opioids for an acute pain incident. But again, that choice is a highly personal one. That's up to the family. It's up to the individual patient. And unfortunately, all too often, they don't have that choice. And so what we try to do is we try to advance federal policy solutions that give them that choice and give that choice to the provider, and make sure that we are the most responsible stewards of opioid pills that we can possibly be.
And what about the choice? And we've heard stories of people that 4 or 5 years later say, this is how I got addicted. Mm-hmm. What about the person that goes in, you have a child goes in and gets oral surgery, gets their wisdom teeth pulled, and they come home with a bottle of 40 pills when they should use 12.
Yeah.
If the system doesn't support them, should the parents throw the other ones away, use the 12, knowing that they could be protecting their child from long-term damage?
So what we know is that there is a very specific path to addiction for certain patients in this country that starts after an acute pain incident. In fact, every year in this country, roughly 3 million Americans go on to become newly persistent opioid users following an acute pain incident, which means they're still taking opioid pills roughly 3 to 6 months after the acute pain incident when their pain should have subsided. This indicates to us that there is some kind of a problem that is occurring. And so from our perspective, what we need to do is we need to make sure that we can prevent this segment of Americans from becoming or misusing opioid pills. And so to us, that means that we make available other options. And for those parents that may be told that they don't have options, I think what I would tell them is they might want to explore other providers who might give them options. Not all providers are necessarily aware of or have access to non-opioids, and it depends on a variety of factors, including their training, their comfort level with some of these different approaches. And so I think it all starts with them needing to be able to ask some questions. And I think part of that pre-surgical consultation or some of these conversations that they're having can and should be about exactly what the preferred method of pain management is that particular provider wants to use, and ask questions about how they might be able to make available some of these non-opioid choices for their loved one or their child.
I know that there's been a lot of talk that for many, many cases where people have been using opioids, even chronic use, that aspirin, acetaminophen, ibuprofen, all of these things do a better job even. Well, obviously, once you're past a few days where the medical efficacy of the opioid is at its peak and then goes to the addictive phase, obviously they're better, but it's been a long road to get there. Now, one of the things that you're working on, and we have a couple of minutes to talk about it, is this No Pain Act.
Mm-hmm.
That's really, really important. Can you give us a little bit run through on how that fits in to our conversation today and what that does to help people?
Sure. And so you listed a couple different non-opioid approaches that have been demonstrated to be effective in helping patients manage their pain. The fact is that there are a wide array of FDA-approved, safe, and effective pharmacologic and non-pharmacologic acute pain treatment options that have been deemed to be safe and effective. And unfortunately, largely due to the fact that they are seen as slightly more expensive than opioid pain relief options, they are underutilized when it comes to pain management approaches. And so what the No Pain Act would do, and the No Pain stands for Non-Opioids Prevent Addiction in the Nation Act, and it's been introduced in Congress in both the House and the House of Representatives and the Senate. What it would do is it would provide and fully incentivize the utilization of non-opioid pain management therapies by improving the reimbursement for these approaches. And so essentially what it does is it would take the economic consideration of opioids versus non-opioids out of the equation, and it would make this a provider, patient, and caregiver decision. And so if you take the economics out of it and you make sure that all other things are equal when it comes to reimbursement for these approaches and pain management is equal, and then you start to consider in some of the other additional benefits of utilizing these multimodal strategies which prioritize non-opioids, you start to understand that the economics makes sense to utilize non-opioids when you start considering that these patients can go home from hospitals more quickly, they suffer fewer opioid adverse events, and obviously carry with them the significantly reduced risk of opioid misuse. And so the No Pain Act would fully incentivize the utilization of non-opioid approaches. Again, it would do nothing to disincentivize the utilization of opioids. Again, all we're saying is let's put all these pain management approaches on a level playing field and let patients, family members, caregivers, and providers figure out exactly how they want to manage pain.
Yeah, and if I can give it a plug before we go to break, it's a nonpartisan effort that really addresses many of the problems we talked about the show before talking about the act, and can really create a solution for people and maybe put some brakes on this train, because the opioid epidemic is going to kill another 70,000 people this year. At the same time, it's overshadowed by the COVID crisis, and it's a breath of fresh air to see legislators in Washington working on a solution to something that's hurting so many Iowans.
Yeah, that's right.
Yeah. When we come back after the break, we'd like you to share some final comments and some advice for our listeners based on your experience in dealing with policy in Washington and this problem. You don't want to miss this. We'll see you after the break.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids' schooling online, and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Talking about opioids and efforts to find better choices to deal with the problem of pain. Let's hear what advice Chris has for us.
Thank you, Peter. So we talked a little bit about the No Pain Act, the Non-Opioids Prevent Addiction in the Nation Act. The fact of the matter is that this is a vitally important piece of federal legislation, and we need your help to get it over the finish line, to be perfectly candid. So what we have is we have an action center on our website, which is www.nonopioidchoices.org. And on that action center, you can go and you can send a letter to your member of Congress, your senator, and tell them that you need the No Pain Act enacted into law. I think what we have before us is we have the opportunity to make a real difference in the opioid addiction epidemic that is gripping this country right now. And the No Pain Act can significantly decrease the number of patients who go on to misuse opioids in this country. So together, with your help, I think we have the opportunity to really improve patient care, improve pain care in this country, and pass a piece of legislation that is badly needed and do it in a way, I think, together that, as Peter said, this is an issue that is bipartisan. It has robust support in both members or both chambers of Congress, and we hope we can get it over the finish line. But we need your help, and hopefully you'll weigh in and you'll let your lawmaker know that it's important to you, just like it is to us.
Is it safe to say that because of the sort of craziness in this world today, that it's a little bit tougher to get legislation like this passed? So it's very, very important for people, especially Iowans that care about these issues, to get involved with their legislators.
It's always important that legislators hear from their constituents. And so the Iowa delegation, I know, would appreciate hearing from Iowans about issues that are important to them. And hopefully this is an issue that is important. Obviously, in these days and times that we're in, with partisanship, going throughout the country, issues like this that have such robust bipartisan support are unique, and they're unique opportunities for us to come together as a country to speak with one voice about needed policy change. And I hope the No Pain Act is an opportunity to do that. And I really hope that, Peter, you and your followers and the listeners here today will engage with us, and that we can go with one voice and say that this is a piece of federal policy change that's needed and that we can push it over the finish line together.
You're a dad. You have a couple of young children. So you think about these things in the future. As a dad, with things like this legislation, can we solve this problem called the opioid epidemic? Is it moving in the right direction?
I think we saw years of progress that, unfortunately, we saw a bit of a hiccup at the end of last year, and we're seeing a hiccup, so far this year. We try not to boil the ocean. We know that there are millions of Americans who suffer from substance use disorder. What we also know is that there's a specific subset of that population of Americans who misuse opioids that starts after an acute pain incident that we can solve for. And so this is a part of the problem that we can solve, and together we can solve for that. So as a parent, I know what choice I would make for my children, and I hope that more and more Americans and more parents and caregivers are empowered to make that choice for their children. And I hope that together we can come together and speak with the same voice to say, this is a policy change that we need, and we can do it to make sure that my children, others' children, can have a choice when it comes to managing the acute pain.
Thank you so very much. That is a great message. And thank you all for joining us today. You can get more information on our website at ahealthyiowa.org. Keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. On Mediacom MC22, your local programming leader.